Mode.
Hi there, welcome to our webinar, A New Era for Georgia Professionals, e-Referrals and the Georgia Tobacco Quit Line. Before we begin, I'm going to let everyone know that this webinar is being recorded and I've muted the phones of all attendees. My name is Maria Martin. Also joining me is Dan Scarf. He's a manager with IT Apps Development at eHRs Wellbeing, and I should say I'm a Client Services Manager at eHRs Wellbeing. So Dan is going to be describing the technical components of e-referral implementation a little bit later. All right. To start with today, we are going to talk about these items. What is the Georgia Tobacco Quit Line? How can providers implement electronic referrals to the Georgia Tobacco Quit Line? And the components of this include both the organizational elements that have to be in place before e-referrals are set up and the technical requirements for sending e-referrals. At the end, we'll have a Q&A forum where you'll have a chance to ask your questions about e-referrals. And what I will say is that as questions come up, you may write your questions in the question bar, which is at the lower right-hand corner of your panel, and we'll discuss them at the end. So please feel free to kind of write the questions in the bar, and we'll talk about them at the end of the presentation. So first up, what is the Georgia Tobacco Quit Line? The Georgia Tobacco Quit Line was founded in 2001. It's funded by the Georgia Department of Public Health, and it's operated by eHRs Wellbeing. In addition to the Georgia Tobacco Quit Line, we operate 27 other state quit lines. We routinely serve over 10,000 Georgia residents per year. We have over 28 years of experience providing highly specialized, evidence-based tobacco cessation services to eligible participants. Georgia residents can call the Georgia Tobacco Quit Line and enroll in the program for free. This program includes individually tailored telephone coaching, a printed quit guide mailed to participants' homes, nicotine replacement therapy in the form of patches or gum sent to eligible participants, and specialized programs for teenagers and pregnant and postpartum women. We also provide referrals to local tobacco cessation resources. How do residents access the quit line? Well, there's a couple of different ways. They can call our English line at 1-877-270-STOP, the Spanish line at 1-877-2-NO-FUME. We also have a TTY line for deaf and hard of hearing callers. And we receive referrals from providers via fax. In a given year, we receive over 1,500 fax referrals to the Georgia Tobacco Quit Line. How this works is a fax referral triggers an outbound call which we make during the participant's preferred time within 24 hours of receiving the referral. We make multiple attempts to call the participant within the next 3 to 5 days, and we then fax back an outcome report with the participant's status to the referring provider. And I will say that happens if the provider is a HIPAA-covered entity. These outcome reports are very rich in detail. They include items such as whether we were in fact able to reach the participant, if he or she accepted services, if he or she set a quit date, and receipt, if they received nicotine replacement therapy, if so, the type of nicotine replacement therapy they got, gum or patches, and the dosages. We have the ability to receive e-referrals from Georgia providers and health systems, although e-referrals have not yet been implemented. As a whole, we've been at the forefront of industry efforts to transition quitline referrals from fax to electronic, and we currently receive electronic referrals from health systems in 6 states. As you know, there's a lot of benefits to e-referrals. They're cost-effective, they're a sustainable way of reaching more tobacco users. They incorporate cessation into routine healthcare delivery, which is imperative. They improve effectiveness, removing time and resource barriers, and they cut down on manual procedures, increasing productivity. We have a couple different competing definitions of e-referrals, so I want to be pretty clear about what we mean about e-referrals. Sometimes people use e-referrals to refer to eHRs, which are configured to send faxes to the quit line. Sometimes they also talk about e-referrals as emails, which are sent to the quit line manually over secure email. So referrals sent over secure email. But what we're really speaking about today are e-referrals that are uploaded to the SFTP from the eHR. Yeah, so these are the types that we'll be speaking about today rather than the other two. More specifically, our process entails processing eHR data delivered to us via an encrypted file that's then, as I mentioned, placed on the secure SFTP server by the referring entity. We can both accept referrals electronically and we can send the outcomes, which I mentioned previously, and back to the providers electronically. That's what we refer to as a round trip. As you may know, there are some challenges to setting up e-referrals. These include the fact that you really do need a champion on the site to be the project owner of the QuitLine e-referral project. As we know, resources within healthcare systems may be limited. In addition, there's a lot of eHR vendors. Implementing e-referrals requires customization of each healthcare system's eHR. Another challenge is building the scripting into the eHR with the busy provider and the clinic workflow in mind. And here you can see a picture of the e-referral flow. Basically, e-referrals from a hospital system, clinic, or physician group are aggregated into a batch file on an SFTP site. Then they're downloaded by the clinic. Discrete data is automatically extracted from the data file and used to auto-populate the QuitLine case management system. This information, as with a fax referral, allows us to make outbound calls to referred participants to enroll them in the program. And as you'll see in the lower right-hand corner, the QuitLine sends feedback reports, which are the outcomes reports mentioned earlier, back to the hospital system, the clinic, or the physician, provided that these entities are HIPAA covered, of course. And one thing I will mention about this e-referral flow picture is that a couple of methods of secure exchange are depicted here, but as for us, we use the SFTP system. So this brings up the question, is your health network ready to start sending e-referrals? Prior to setting up e-referrals, there are some components inside the health system, clinic, or physician group that must be in place. This is the organizational checklist that I referred to at the beginning. First up is meaningful use. So the HITECH Act, which was part of ARA, created financial incentives for hospitals and healthcare providers to adopt, implement, and demonstrate meaningful use of certified eHR technology. The Meaningful Use program is currently being rolled out, and it has implications for some health systems for e-referrals. And I want to say that for specific questions around meaningful use, a great resource is your health system compliance officer. Next up, a really important component is engaged stakeholders. It's very important to find a champion for the project. The workflow redesign is most likely to succeed if someone within the practice, typically a non-clinician, like an office manager or a medical assistant, steps up as the project owner. In some cases, modifications to the eHR must undergo various types of internal review by entities such as physician advisory boards, and it's helpful to have an on-site proponent for the project. Next up, very importantly, is budget allocation. Has budget approval been received for the IT effort that is required to build out the eHR software to send e-referrals? And finally, very importantly, have providers been trained in BTI, the Brief Tobacco Intervention? And kind of as an aside note, I want to mention that we are currently building an online provider training, and providers can get CME credit for the Georgia Department of Public Health. It trains providers in Brief Tobacco Intervention, the 5 A's, the 2A and the R, which I understand you're very conversant with. It also trains on communication strategies derived from motivational interviewing, and it's going to include additional information about pregnant, postpartum women, smokeless tobacco users, youth, and proper NRT use. This training is scheduled to go live on June 30th. I think it's going to be a great resource for those providers who want to incorporate tobacco cessation into just regular patient visits. So if you answer yes to these items above, then you're ready to work with us to implement e-referrals to the Georgia Tobacco Quit Lines. At this point, I'm going to let my colleague Dan Scarf jump in to talk a little bit about the technical implementation process. Take it away, Dan.
Hello, my name is Dan Scarf. I am a software development manager at eHRs Wellbeing, and I oversee the code and software systems that process eHR electronic feeds. And I'm going to spend a couple minutes talking about, in some detail, talking about the process around getting the feeds set up and how we typically work with clients to get the feeds up and running smoothly. So about 3 to 4 weeks prior to the go-live date for the eHR feeds, we typically get a request from the client via the CSM that the client will want to go live with an eHR feed. And that will be a date that eHRs and the client will kind of co-determine together, a date that makes sense to both sides. We have some flexibility, but just the main thing is that we need that 3 to 4 week buffer. And what we'll do is that eHRs will provide the client with a standard file format. So the file format typically will have things like different record types and file types and patient data, the first name, last name, eHR ID, date of birth and address, gender, and things like that. Things that to uniquely identify the patient in our systems. And that's a standard format that we use with all the eHR implementations that we do. So we'll be looking to have the data submitted to us in our standard file format, and we have a specific naming convention as well. We'll set up a secure file transfer mechanism, and as was mentioned earlier, we use SFTP, which stands for Secure FTP File Transfer Protocol. And then we'll also provide an eHRs public key for file encryption. And the IT department of the client implementing the eHR feed will know what to do with that public key. It's basically a way for the client to sign and encrypt the file that gets sent over to us to ensure that that the privacy and data integrity is maintained. The client will then send eHRs a test feed, which is a sample feed of some sample data that will have kind of dummy patients in it. The file will be named using a test naming convention, and then the client will notify the CSM of the delivery of the feed. eHRs then goes through its own internal feed validation and testing process, where our eHR development team validates and processes the test file that the client sends over inside our development environment. So no real data is sent over at this point, and no referrals are actually, our participants aren't actually reached out to. We test for things like deficiencies, file soundness, the correctness of the expected format. And if it passes if it fails the initial set of file validation, then the CSM will notify the client to correct any errors that we observed and then send a new file back. And that iterative testing and validation process repeats. And then there's a second level of validation that takes place where we work on the recruitment outcomes, and then we start posting sample outcome reports back to our SFTP folder so that the client can pick those outcome reports up and make sure that they are acceptable. And once the file passes processing, then we launch the eHR production file process, and that's when the production data is finalized. So at a high level, before we start passing files back and forth, the CSM and the client agrees to a tentative date in the future. We provide details to the client on the standard file format, naming convention, and how to communicate that file to us and how to encrypt it. We go through a couple rounds of internal feed validation and testing process, and then we go through another round of testing to validate the outcome file. And once that's all passed and good, then we launch the eHR process in production. Does anyone have any questions about that?
I think we can maybe save the questions for the end here, but please feel free to type in any questions that you have. Thanks for that great explanation, Dan.
You're welcome.
So, yeah. So basically, if you are ready to set up e-referrals, what you can do, the next step is to contact Joanna Calhoun or Keith Busey, and their contact details are here at the Georgia Department of Public Health. What they will do is they will loop in myself, and I'll bring in the technical team to start the technical implementation process, which Dan just described. Also, as you'll see on this slide, is a link to the cAARds, webinars, and training. This webinar, which has been recorded, will be posted on the cAARds site. And I know that many of you probably want the webinar slides. So Dewana has asked me to send out a slide stack to all attendees. You can expect that from me later today. You can feel free to share those slides with your colleagues. Also on this card is a link to the Georgia Tobacco quit line itself. Okay. Now at this point, I would love to open up the floor for questions. And again, you can type your questions into the question window. Or if you would like to speak your question, please raise your hand using the raised hand icon. And you can ask, I will then unmute your line, and you'll be able to ask your verbal question. We'll also make the comment that if you joined the call using VoIP, but you have a verbal question to ask, you'll need to dial into the conference line to ask your question. Okay, so it looks like our first question is the PowerPoint presentation available? Yes, I will send that out to everyone after the conference today. Any other questions, please go ahead and type in your questions, or alternatively raise your hand and I'll unmute your line. Okay, we've got another question here. Can this tool be used at a community health fair? And so I assume that by the tool you're referring to the electronic referral. Is that correct? My feeling is that it might not be. Yes. Okay. Yes. And my feeling is this might not be the best sort of referral method to use at a community health fair, because it really is sort of like incorporated into the eHR, and it's sort of meant to be used with the engagement between a provider and a patient. But at this point, I'm also going to let either Kara Gordon, who is a director of client services, I'm going to let her jump in, and maybe Dan can also have some comments. Okay, take it away.
Thanks, Maria. Hi, everyone. This is Kara Gordon. I'm a director of client services at Alere Wellbeing, and that is an excellent question. And at this point, the eHR software that we can support is actually, as Maria mentioned, it is from a provider into their eHR system. And that actually comes to us as a batch file. So multiple providers will submit their referrals into the system, and then the eHR software will basically turn it into a batch file that's delivered to Alere via SFTP site at the end of the day. And then we process those referrals and make outbound attempts and then send outcomes back. So that's the current functionality that we support and that other vendors right now support. I know there are pilot programs being done in other states around the method that you're describing, where you could have an iPad at a kiosk where different participants could basically refer themselves or speak with somebody at that kiosk. But at this point, that isn't something that we can support. So you guys are thinking a few steps ahead, which is wonderful. But at this point in time, we support the referral directly from the provider into the eHR system and sent over to us. Dan, did you have anything else you wanted to add to that?
The only thing I wanted to add is that I wanted to clarify that the number of referrals sent in are actually batched up into a single file. So the system typically will work like it will receive and process one file per day, but each of those eHR feed files can have an arbitrary number of referrals in them. So if the client does one referral or 10 referrals or 1,000 referrals a day, it doesn't really matter to us, and it doesn't matter to this process. This process will accommodate an arbitrary number of referrals that are all batched up into a single feed file.
And just to add to what Dan was saying regarding having this at a fair or at a kiosk, the tricky piece around that, just so you're all aware, is the security around it. So we need to make sure that any participant information that is submitted goes through secure systems because of HIPAA compliance. So that's also just a challenge with our future thoughts around how to make this more accessible at community events and in kiosks. But those are great thoughts.
Yeah, very good idea. And the other thing I'm thinking is that if you do want to collect participants' names at a community fair, what you could do is you could collect a list and make sure you get the sort of appropriate times, the preferred times to call them. You could give that list to Keith or Dewana via secure email, and they can send it on to me, and we can make those outbound calls. So just like one more idea. Okay, looks like we have another question here. What is the phone number of the Georgia Tobacco Quit line? So I've displayed the slide here with the phone number, 877-270 stop number, as well as the Spanish number, and the deaf and hard of hearing number. So I hope that answers your question there. Okay. Looks like we have a couple more questions here. Okay, here's a comment. We regularly give patients the tobacco quit line number. Will this be free? Okay, it's wonderful that you give patients the tobacco quit line number. You know, across the board, the way that a lot of people hear about state quit lines is through their providers. So, you know, it's a very powerful kind of referral. And yes, the services from the Georgia Tobacco Quit line are free. Next up, please note, are people able to self-refer? That's a great question. Yes, people are able to self-refer to the quit line. You may have seen some of the national CDC campaign tips ads that were running earlier this year with the 1-800-QUIT NOW number on them. Anybody who calls that number with a Georgia area code is directed to the Georgia Tobacco Quit line. So yes, lots of people self-refer to the quit line. They see the number on ads. A friend tells them about it, and they call the quit line. So the answer to that is yes. Good question. Okay. Let's see. So I don't see any more written questions. I'm going to see if anybody has their hand raised to ask a verbal question. Okay, it doesn't look like it. If you have any more questions, please feel free to either raise your hand or to write them out. Okay. Well, so I'm not seeing any more questions, and nobody has any raised hands. So if there's no more, oh, okay, here we go. Here's a few more. A possible suggestion is to include the actual numbers in the print media, for instance, 1-800 and then the numbers. Yes, so that's a very good suggestion. Yes, good idea. And I think in a lot of media, we do include the numbers as opposed to just like the 270 stop. So, yeah, that's a good point, because I always find that I'm having to search for the numbers on my on my phone when I'm only given letters. Very good point. Cool. Any other questions? All right. Well, I'll also check the attendees and make sure that nobody has their hand raised. Nobody would like to ask a question. Doesn't look like it. All right, wonderful. Well, hey, so thank you so much for joining this webinar today. I hope it was helpful to you. I enjoyed, talking about e-referrals. I appreciate all of the staff members who were able to join me today to answer your questions. Again, if you would like to set up e-referrals, if you feel like you're ready to do so, the next step is to contact Keith and Joanna, and they will help. They'll loop me in, and we will set up the technical implementation. All right, so thank you so much for everything. Hope you all have a wonderful day. All right, bye-bye.
Thank you.
Thanks. Bye.
Goodbye.